And it's all yours.
Great. Peggy, why did you get into healthcare quality?
I got into healthcare quality because I was on a kind of a journey trying to find my profession. And I had been a French major in college, and I decided I didn't want to be a French teacher. So I thought healthcare looked interesting, and so I got a job as a respiratory therapist. And I did that for 5 years in a number of different places. And the big thing that hit me was how bad the quality of healthcare was, at least in the hospital, and that was where I first came to see it.
And you founded NCQA. What was it like in the early 1990s as a female leader creating a brand new organization?
It was pretty tough. I was fortunate to have a lot of people who really believed in the idea we were trying to build, and that was both men and women. And so I had like a board of directors that was like a cheering section for our mission. You know, we were helped by the fact that employers were going for HMOs, and they wanted to make sure they were putting their employees into quality organizations. So.
Can we redo that one, which you can restate the question to the answer? Because if we leave it by itself, I don't know what you're talking about. Was it difficult to start? That was the question. You said, yeah, it was very difficult. But from the audience point of view, we don't know.
So we're not hearing Andy's question, you mean?
Correct.
Okay, I get it.
Okay.
That's going to be awkward, though.
Well, it'll look fine.
Okay.
Edited. So the question, which will not be heard, please essentially restate the question. Peggy, what was it like as a female founder creating NCQA in the early 90s?
Hold on 1 second.
That was a different question.
Was it?
I think so.
I don't know. It sounded like it, but it's different. Right?
It was different.
Peggy, tell us in your own words. What was it like?
Well, Andy, it was actually something that felt impossible. And I had a cheering section of people who were on the NCQA board who said, go for it. We really need this. These were largely employers who wanted to have their people in high quality health plans. And it was also some of the health plans that were at the high quality end of the spectrum. And so they helped me, and it felt like a movement. And I really couldn't have done it without the other people that were there. So it was like a moment of real opportunity to kind of move this agenda. And I had come to this from 5 years of experience as a respiratory therapist, and just being shocked at how disorganized the care was in hospitals. And that evolved to a larger understanding of the way our healthcare system runs.
What do you see as the most critical gender inequities in healthcare that need to be addressed?
The gender inequities in healthcare, I think there's just a general way in which when women say something, it's often regarded with less respect than when men say it. And I personally believe this is deeply embedded. It's not a thing that you just decide you're going to get rid of because it doesn't serve you. The notion of implicit bias, it applies to women as well as to men. I mean, as to other categories. Can that be fixed? Yeah.
Would you say it again in your own words?
Hold it
Implicit bias.
1 second. The cable came out of nowhere.
I don't actually think gender bias is like a big deal. So I don't know if you want to really, I don't think you want to do too much. I can talk about it, like as a woman leader. But in healthcare, I could say a few things about how research was always done on, white men and, yeah, okay, all right. You can ask me that one again.
I forget what the question was.
Gender bias or gender,
So, Peggy, what are your thoughts on gender inequities or gender bias in healthcare?
So you're asking me about gender bias in healthcare. So let me just speak to that first on the level of the delivery system and the science of delivering healthcare. I think we are emerging from a time when research itself was heavily driven by the subjects being white men and also being people who are generally healthy. And then it just led to a lot of confusion, I think, in the evidence. Now I think the scientific establishment is well aware of this issue and has really worked hard to diversify the subjects of research. So on that level, it's pretty good. If you look at scientists now, Jennifer Doudna won the Nobel Prize. There are amazing women scientists out there who, and actually to me, are doing some of the most dramatic and paradigm-busting kind of research. So I think that's really good. I think, if you look at the leaders of hospitals, a lot of them are women now, and that was not true in the past. Many of them are nurses, which is great because I think hospitals are really dependent on the dedication of nurses. So in a lot of ways, it's better. There are still things like, old attitudes and implicit biases about women that, like that women, when they complain about pain, it may be just something in their heads. But I think these are being swept away. I think that we're outgrowing that kind of thing. I mean, it's much easier, I think, relatively, for women than it is for other population groups that have experienced a lot of bias.
Why is it important for women to work in healthcare quality?
I don't know if it's important, but it certainly is packed with women.
Why do you think that is?
I have a good explanation and I have a bad explanation. I think the good explanation is that women care. They go into healthcare because they care about people, and when they learn about quality and some of the stuff that goes on, they really they want to make sure that the quality is better because people are harmed when quality is poor. On the other hand, I think when women are prevalent in a profession, it tends to be less powerful, and so quality people are usually not. They're certainly not as powerful as, for example, finance people in the hospital. So I think there's some of this that's just a result of, who's the workforce that aren't the doctors in the hospital. There are a lot more women doctors now too. I don't know if that came across, but.
That's good. How has NCQA's work improved quality of healthcare for women in the United States?
Well, we have measures that relate to women, like pap smears, cancer screening measures, pap smears, mammograms, and those numbers have improved over the years. But in many ways, like the chronic conditions that afflict men and women, in maybe not exactly equal numbers, but both are really a big deal for both men and women. I think as part of the general population, we've done a lot better with a lot of chronic conditions that have very high consequences if you don't manage them well.
What advice would you have for female founders creating new enterprises or nonprofits today?
He's holding his finger out for you.
Yeah. He only gets passed, so.
Advice for other female founders is, remember, it's not about you. It's about the mission that you're trying to advance. And in a funny way, I think that really liberates you from your own fear and insecurity.
What other thoughts would you like to share with the quality community in this?
Well, I think I just want to thank all the people that make quality happen every day. And they are, in fact, many women, because I think they are having an impact. But I don't think only of the people who have quality in their titles. I think of the nurses at the bedside, all the people that work in hospitals and in the delivery system at all levels that are heavily women, community health workers. So I just want to say that your good work is helping Americans be more healthy, and I hope you appreciate that because I know your jobs are really hard.
One last question, and this is just my personal curiosity. How did being a woman help and hinder growing NCQA?
Being a woman helped because I was underestimated quite a bit. And it also meant that people didn't take me,
Help what?
what?
Help what? When you were answering?
Well, in English we say it helped or it hindered. Yeah, you know,
I think
so
he's saying the object.
Yeah.
Being a woman helped grow insecure. Helped
Correct.
grow insecure.
oh, okay.
Yeah, there you go.
Well, I think being a woman was an advantage when all along the way, but in the beginning, I think there was a funny and kind of paradoxical advantage to being underestimated, and I certainly was underestimated a lot. But also, I think you know there are benefits when mentors, male mentors, want to help. And I had a number of male mentors along the way, you know, from my first boss at HHS to, you know, people on the board, Gail Warden, who was the chair of our board. So there were just a lot of people with a lot of experience who were kind of in my corner. And, you know, I think also women are more likely to accept help without feeling that it makes them less than. And I was definitely always very open to receiving help from others.
Good. Why don't we leave it at that?
Yeah.
I think so. Unless there's anything else you'd like to add.
I don't know.
Okay. Excellent. Good.